Okay, this is an ultrasound of a first trimester pregnancy. Up here is the uterus. You can start to see a very early gestational sac right here, but down here in the cervix, what is this? Another first trimester ultrasound. This is the cervix, again, with this bright structure in it, retroverted uterus with the gestational sac. And finally, here's another first trimester ultrasound. Down here is the cervix because it's what we call a coronal view. This is the uterus, gestational sac, and this T-shaped structure here that's actually properly placed in the endometrial cavity or lining of the uterus is an IUD. Let's talk about pregnancy with an IUD in place. There is an increased risk of ectopic pregnancy if you have an IUD in place. So if you have an IUD and you have a positive pregnancy test, see a provider sooner than later to confirm location of that pregnancy. Now, pregnancies that are intrauterine within the uterus with an IUD in place are at increased risk of both maternal and fetal complications. And these complications include infection, miscarriage, preterm birth, and abruption. If the strings of the IUD are visible when we do a speculum exam, or the IUD is shown to be in the cervix on an ultrasound, then we go ahead and remove the IUD as early as possible in the pregnancy. If the IUD strings are not visible on speculum exam and the IUD is not shown to be in the cervix on ultrasound, then it is generally recommended to leave the IUD in place. The CDC reports that copper IUDs had a failure rate of 0.8%, while the levonorgestrel IUDs had a failure rate of 0.1 to 0.4%. If a patient is pregnant after IUD placement and we don't see it on ultrasound, we will get an x-ray to make sure it's nowhere else within the uterus that we just didn't see, or possibly in the abdomen. But if we don't see it, the most likely explanation is that it was expulsed or it fell out and the patient just may not have realized it. Did you get pregnant with an IUD or know someone who did? Tell me about it in the comments.